Organization expert says it is impossible to tell when the Wuhan coronavirus will peak. New cases are still popping up around the world on a daily basis. In mainland China, at least 132 people have died, and there are more than 6,000 confirmed cases. 91 cases have been reported elsewhere. Now, the WHO says human-to-human transmission outside of China is, quote, deeply concerning. Their emergency committee is set to meet Thursday to decide whether it is now an international emergency. In Seoul, South Korea, potential coronavirus cases are being examined in temporary facilities there. Paula Hancock is on the ground.
This is the National Medical Center in the heart of Seoul, and this is where the South Korean government has decided will be the main hospital for those who have coronavirus or those who are suspected with having the virus. Now, we know there is one patient here already on the 7th floor in this building behind me. You can see many of the medical staff not taking any chances. Just inside there, they have their hazmat suits on. And this is the area where those who think they have symptoms of the virus will come. They want to make sure here that those who are worried that they may have the virus are not going to be mixing in with the rest of the hospital population, because there are still plenty of regular patients here. So this is the main reception area where they will come inside, and this is where they will be processed. A little earlier on this Tuesday, President Moon Jae-in came to visit this facility. He wanted to make sure, he said, that everything was up to scratch. He wanted to make sure that enough was being done and the priority was being put on coronavirus. Now, just on Monday, the government raised the alert level to the second highest level that it could be. And what that does, it means that the government takes over the control as opposed to the CDC. And it means there's an emergency task force that is being set up to deal with this as well. As we're filming, we're moved back by medical personnel in hazmat suits as potential patients arrive to be tested. They're given a CT scan in the country's only mobile CT scanner, trying to detect viral pneumonia so potential Wuhan patients can be segregated. A 55-year-old South Korean man was brought in last Friday and has been confirmed with the virus after travelling from Wuhan. Dr. Kim Yong-jae has been treating the patient and says he's stable, but he believes the next week could be critical in stemming the spread of the virus. The virus can mutate very easily, he says, and if we have a super spreader due to the mutation who's infecting more people than usual virus carriers, this is very hard to combat. That is what I'm most concerned about. Now, this hospital is preparing for future patients through these two double doors. There are 7 individual rooms, a bed in each of those rooms. There's negative pressure, we're told, to try and make sure they can contain the virus. And they are all ready. They are waiting for potential patients to come. The government is planning to send 4 charter flights to Wuhan later this week to evacuate up to 700 South Korean citizens from ground zero of the outbreak. They have initially tested negative for the virus, but will stay at a separate facility for 14 days to avoid spreading infection. Anyone with symptoms will be transported to this hospital, where empty beds are waiting. Paula Hancock, CNN Seoul.
Well, several countries are trying to get their citizens out of Wuhan, including France, which is sending a plane Thursday to take its nationals out of the quarantine city. Only French nationals without symptoms, though, will be allowed on board. The U.S. evacuated about 200 people from Wuhan. They're now getting screened at a base in California, and Japan says it has about 650 citizens who want to leave and will make arrangements to send enough planes. Morocco says it's trying to get about 100 Moroccans, mostly students, out of Wuhan. And South Korea says it's sending several charter flights to Wuhan to get some of its citizens out.
The department tonight says some 700 American citizens want to get out of Wuhan as quickly as they can. But once they arrive here back in the U.S., getting home may not be an easy option.
The chartered cargo plane touched down at March Air Reserve Base near Riverside, California, carrying 195 American passengers, all fleeing the city of Wuhan, China. Taking no chances, authorities in full hazmat suits boarded the flight, diverted from a public airport to a military one. Inside the packed plane, many grew desperate to escape the epicenter of the coronavirus. For now, no one going home.
They're scared. You're scared. We understand that. There's a lot about this virus that we don't know.
With one American who had a fever turned away from the flight back in China, a 72-hour hold is underway for all passengers. The CDC says in isolation rooms like this one, they can try to contain the potential spread of the coronavirus, infecting at least 5 people in the U.S., while another 160 are being monitored in 36 states. Today at Boston's Logan Airport, a sick passenger taking off an arriving flight from Beijing.
I hope this can be over soon.
With fear spreading as fast as the virus, today international airlines from around the globe, including American, are canceling or suspending flights into major cities in China. Sam Roth from Wisconsin is desperate to get his wife and 2 daughters out of Wuhan.
I don't want them to get sick. I want them to come home.
With worries over a pandemic growing, the U.S. government says masks like these in short supply overseas are not necessary here at home, tonight balancing the thin line between concern and panic.
From the streets of New York City to airports around the nation, we're seeing more and more people donning face masks after a handful of cases of the new coronavirus landed in the U.S.
I feel a little bit more safe having it. I know it's not 100%, but I think it would be unwise not to take any precaution I can.
While it may make some people feel better to have them, the CDC says wearing a face mask to protect yourself from this new coronavirus is actually not recommended.
It is unnecessary. As we said, in the United States, the risk to any individual American is extremely low.
That's because there's not much evidence that face masks benefit the general population. Dr. Frank Esper is a pediatric infectious diseases doctor at the Cleveland Clinic. He says it's really the sick person that should wear a face mask.
If they are feeling like they have symptoms, we do ask them to put on a mask when they're coming to waiting rooms or the emergency department, or when they're going into a public space. It helps prevent the spread of infection.
In fact, face masks are not recommended even during the throes of the flu season. Experts say there are better steps to stay healthy.
So wearing a mask when you don't have symptoms is not really that helpful. What is helpful, though, is washing your hands.
And also, try not to touch your eyes, nose, and mouth, because viruses can spread easily from common surfaces.
In major Canadian cities are already shrinking or disappearing because of development and migration to the suburbs. The threat of a new disease is hurting what little business is left. Terry Chu, an activist, is collecting the disheartening stories.
People, are afraid that they have a cough, and you see people just choking back their coughs because they're just afraid of what people will think of them because you are Chinese, and people just keep their distance from you.
The viral nature of social media is exacerbating ignorance surrounding the new coronavirus, calling it the Kung Fu flu and suggesting it's a product of Chinese food.
We are being singled out. We are being stigmatized because of the coronavirus.
It doesn't help that a major Toronto newspaper recently published this editorial cartoon. All this misinformation is prompting health officials to call for calm.
Now I'm getting people telling me, oh my God, don't go to this part of Toronto because, there's lots of Asian people there. That's how this descends very quickly. And that's exactly what happened during SARS, and none of that is remotely helpful.
Well, that's part of the racialization of Asians, right?
John Paul Katungal is with the Social Justice Institute. He studied Canada's history with the Yellow Peril, recycling racism against the Asian community when there's an outbreak.
There has been kind of a long-standing narrative around Canada's vitality being threatened by the presence of foreigners.
What happens if something is coming from England? Are we racializing them as well?
Queenie Chu is a nurse who works with immigrants and believes the rampant racism isn't helping any Canadian.
I don't think we should racializing this because where it came from.
That tendency to blame comes from not knowing what's real and what's false, and tapping into simplistic stereotypes isn't making us more informed.
Johnson & Johnson said on Wednesday it is working on developing a vaccine for the new coronavirus that has already killed more than 100 people and infected thousands in China. The company said the vaccine program would utilize the same technologies used to make its experimental Ebola vaccine, which is currently being administered in the Democratic Republic of Congo and Rwanda. The company also said it was donating an HIV drug to China to use for research to find a solution against the outbreak.